All right, one more Medicare minute before I call it a day. So today we're going to break down what Medicare costs in 2026. And this is just the basics. Um, I'm going to give some numbers, but this is the numbers as of 2026. They adjust accordingly every year. So keeping that in mind, Part A, which covers your hospital stay, has a deductible per benefit period. Now, that's very important to understand. Your benefit period is I go to the hospital for 3 days and then I stay out 90 days. Well, I pay the deductible, which in 2026 is $1,736. So I pay that in my first stint in the hospital. But if I stay out after 60 days, then that benefit period resets. So that's your deductible per benefit period. After that, you'll pay a daily coinsurance if you stay past 60 days, and even more if you use your lifetime reserve days. So if you need skilled nursing care or things like that, there's also a daily cost after day 20. So keep that in mind. To pay for Part A, normally it's already paid for on your behalf when you work 40 quarters or 10 years. If you came in late or you didn't pay into it or anything, you have the opportunity to purchase it, and it could be as high as $565 per month to get that. So you have the $565 per month, and then that one deductible per benefit period of $1,736. Part B, which covers your doctor visits, your outpatient care, has an annual deductible and a monthly premium. And once you meet your deductible, you typically will pay 20% of all Medicare approved amount for services. That's another keyword. Medicare approved amounts. If it's not Medicare approved, that's 100% your responsibility. So for Part B, your monthly premium for 2026 is $202.90. And you also have a annual deductible of $283 that you would have to meet before they would cover your 20% and all that other stuff. So a couple of things to keep in mind here: Medicare approved amounts for services, and these are also um, a lot of times they are negotiated price, so they could be cheaper, but ultimately it's 20% of the cost. Part C is your Medicare Advantage plans. They vary wildly. So deductibles, co-pays, co-insurances, maximum out of pockets, pocket limits. They all are very plan specific, and each plan is dictated or governed by a zip code. Um, Depending on your zip code is which plans are going to be available to you. Part D is for your prescription drug plans. Now, keep in mind that so if you have to go to the pharmacy to get your medication or to get your shot or to get something, that would be more your Part D plan or your Part D deductible. If it's in the hospital or it's considered inpatient, that would be, or outpatient, that would be considered your Part B. So it really depends on where you get your medication from, dictates which part of Medicare will be covering it. So back to Part D for your prescription drug plans. These also vary, but they also include deductibles, monthly premiums, and cost sharing depending on the medication that you're on. So, bottom line, Medicare isn't a one flat cost. Each part has its own structure. Each cost can add up if you're not prepared or not planned. If you didn't create your plan properly. So, if you have any questions or any concerns or anything you want help figuring out, what Medicare costs could look like for you, reach out to us directly. Call us at 915-228-4866, or you can email us at info@gssin.com. Our information is in the description below as well. So we're here to help you make it make sense. So that's my Medicare Minute for the day. Thank you guys so much, and I look forward to seeing you on the next one.